Thank you.
Next, if you've never been the athletic type, you could begin experiencing those all too familiar aching joints, frequently caused by arthritis.
Jay, 37 million Americans, both young and old, have arthritis. Tonight, we take a look at osteoarthritis, a painful condition causing stiffness and limited mobility. Dr. David Carfagno shows us new treatments which can keep us a step ahead of the pain.
She's got advanced osteoarthritis in her knee and has had multiple surgeries and failing to improve.
Arthritis is a debilitating disease, whether it's osteoarthritis or rheumatoid arthritis. Osteoarthritis is the most common arthritic disease. The most commonly it's caused by the wear and tear type of phenomenon. Over time, the joints just have the cartilage that surrounds the joints just cannot keep up with the excessive weight bearing, and it's essentially a breakdown type of phenomenon. There's another type which is also osteoarthritis, but it's related to more to trauma. We'll see in our practice, in our sports medicine practice, we'll see ex-athletes who are in their late 20s, 30s, sometimes even 40s, older than the other population, who have developed arthritis, and that's more from an excessive trauma that they have had in their early life. Most common symptoms of osteoarthritis is going to be, the most common is pain. It's going to be pain in a specific joint. Most of the time it's going to be in your weight-bearing joints, your knees, your hips, your ankles, even in the spine. It's just an increased swelling of the joint. Decreased range of motion. People just don't have the range of motion they used to have.
Does it hurt your knee at all?
Pain in osteoarthritis can be up to what we call 24/7. They have 24 hours, 7 days a week type of pain. That's when the pain gets to be really severe.
While there is no cure for osteoarthritis, there is treatment to help ease the chronic pain.
I recommend a lot of people using modalities such as ice, such as heat, okay, to help with their joint ailments.
It also will help with pain control.
Good.
The first line medications that we use for arthritis are acetaminophen, anti-inflammatories. Alternative-wise, and which is actually becoming mainstream, glucosamine, chondroitin sulfate, MSM, and then the injectable forms of hyaline and hyaluronic acid.
The newest treatment for joint disease is a little more aggressive. It requires injections directly into the joint.
I'm trying to exercise, but really there's so much pain it really prevents me from doing a lot.
This is articular cartilage. That's like the white stuff on the end of a chicken bone, okay? That's partly what goes on with arthritis. This starts to get worn down, and it gets worn down to the point, such as in your knee, where it's almost bone on bone. There's an injectable form, just like a cortisone shot. There's two types. There's hyaline, and then there's hyaluronic acid. Hyaline, otherwise known as Synvisc, is one of the types of intra-articular injections. It's similar to the actual material that's in your synovial joint, meaning if you talk about 10W30 motor oil and 10W40 motor oil, Synvisc is like 10W30, the thicker motor oil. There's another one out called hyaluronic acid, which is Hyalgan, and its molecular weight, or the viscosity, the thickness, is a little bit less. And I'll just go right in underneath the kneecap and right next to the tendon. Okay?
Okay, is it real painful going that deep into the joint?
No, you won't feel any pain at all, actually, because I'm going to give you a little bit of anesthetic spray. The injections afford a pain relief without the side effects of the anti-inflammatories.
Will it allow me to rehab my knee so I can gain some strength in those muscles? Will it take the pain away so I can do that?
Yeah. Okay, you did very well. What most people find is that they're getting the pain relief down the line, 3 to 4 months on end. The main treatments right now for osteoarthritis are those treatments that we've used for a number of years. One is physical activity, to the point where you want to build up your muscle strength and protect those joints. And that's listed as physical therapy. These are modalities that physical therapy does use along with exercises.
Okay. Just trying to activate the quadricep muscle. How does that feel? You get a good contraction?
It's a real strong one, yes.
How does that feel?
Feels comfortable. I can tell that it's got my kneecap moved and holding it in place.
Usually recommend wearing this with any extended period of activity, exercising. And what Jeff is doing here is what's called McConnell taping. And essentially you can learn how to do this, and you can do this at home And all he's doing is he's going to stabilize that kneecap. We'll do a reverse Stairmaster.
This is your leg press, all right, and bring your feet up a little higher.
Surprisingly, there's no knee pain.
So it's important to just do mini arcs. Again, this is working more on her proprioception, her balance. We tend to, as we get older, and especially with arthritis, you tend to lose a sense of balance. And what Sandy is doing right now is teaching her knee joint how to balance. Big proponent for water as a fitness, especially water aerobics.
Get them moving. Good, good. Keep them going.
It's very important, I think, as health professionals to
Good.
help
Your arms
guide
go
people
straight out.
with the exercise.
Pull them up. Come on, pull them up. Pull, pull, pull. Pull your knees up. That's it.
I am very adamant on is people getting some form of exercise. The stronger your body and the stronger the muscles are around your joints, I think the joints are going to become more well protected.
Dr. Carfagno joins us now on set. Doctor, thank you for being here.
Thank you for inviting me.
Obviously, there are many advancements in medication.
Yes, in the treatment of osteoarthritis, in addition to acetaminophen and also anti-inflammatories, a new type of anti-inflammatory is out, the class called COX-2 inhibitors. Their benefit is an enhanced safety profile. Other alternative types of medications that we're seeing that are hitting the more mainstream are your oral glucosamine and chondroitin sulfate, in addition to intra-articular viscose supplementation.
Now, doctor, we're curious to know how your patient Sandy's doing.
Sandy's actually doing very well. She's getting some short-term benefits right now. I think she's going to see more long-term benefits, probably 6 to 8 week range, if not a little bit longer.
Good.
Now, Doctor, sports is obviously an excellent way to stay fit, but not everyone can be that active. What do you recommend then?
People will get some benefit from exercise at all ages. In this population of osteoarthritis, cardiovascular aerobic capacity, I think, is very important, in addition to strengthening up the muscles around the joints. I think what's the most important, though, is the psychosocial aspect of exercise. Starting from a young age all the way up to an older age, I think people do get some benefit with social interactions. And I think that can help out people of all ages.
All right. Thank you very much,
Thank
Doctor.
you.